Hi, horse friends. In today's video, we are going to talk about squamous cell carcinoma, what causes it and what it is, because unfortunately, our two lesson horses behind us, Mr. Chief, who's one of our best guys I've ever had here, and Mr. Dexter both have it. Dexter's had it on and off for the past several years. We fortunately know how to deal with it. It's not a death sentence. It is the second most common form of skin cancer in a horse, but fortunately with early detection and treatment, it can be managed. So it's really common in Appaloosas, paint horses, or horses that have pink skin, and both of these guys have it. Dexter has it on his sheath. I kind of joke every year that he gets his manhood worked on, and that he has the most expensive manhood in the barn. And Chief has it around both eyelids. Now, to some of you might say, oh, why doesn't he have a fly mask on right now? We have a severe snowstorm coming in, and I think it's really hard on horses to wear fly masks in a snowstorm because it impairs their vision. And in order for a fly mask to really help squamous cell, it has to have 90% UV protection. So it can't just be your normal type of fly mask. It needs to be 90%. And honestly, I'm not really sure how much the UV has to do with it. Dexter, for example, where his squamous cell is, it really doesn't ever see the sun. There is a genetic component to pink skin and squamous cell that we will talk about. The treatment for it is generally a form of they either burn it off or they cut it off, and then they do inject the area with some cisplatin. We will be showing you guys a video in the future that goes through the whole process, so stay tuned for that. And just know that this is, now that Chief has been diagnosed with it, it's something we're probably going to have to do every year. Fortunately, our barn, we do eye exams every year, we do dental exams, we do sheath exams. This is one of the reasons why I tell people that you should really have the sheaths looked at by a veterinarian, not just yourself, because veterinarians know how to look for these skin cancers. When they start, it might just look like a little scab towards the lay person, but to a veterinarian, they know what the scab is going to look like, and they know when it is skin cancer or not. That is also why a lot of times you won't see the veterinarians have their assistants do the sheath cleaning. They will do it themselves because they want to feel inside of the penis to see if they feel any skin cancer. They also want to do the exam themselves so that they know what the skin cancer looks like. Now, nothing against vets that might do it another way. This is just what my vet has told me that they like to do. And this is a procedure that is done, look at them fighting with each other, that is done standing. So they don't have to put them under for it when they cut it out, and they put the cisplatin in both in the eye and in the penis. So I'm excited to share this with you guys because I think this is a really good bit of information on how to manage your horses and what to look for, because there's a lot of horses with pink skin out there. So let us know your thoughts, your comments, or if you have any questions. Thanks so much.